Hey guys, it's Dr. Emer. I'm here today in West Hollywood, and I'm really excited because we're doing what we call female facial sculpting. When you have patients that come in and they ask you, say I want a bigger lip or bigger chin because they're influenced by certain things, you really have to look at their face and determine what's important to make them look subtly better but natural, because otherwise you see people that have really overdone looks, like their lips are just too big for their face or their jawline just doesn't match their cheeks. So we have already a beautiful patient. She just did a peel, which is enhanced. I mean, her skin is so much better. I mean, you can almost not even see any of the scarring that she was initially worried about, that we're also going to put some filler in, but she already has beautiful features. You just have to enhance it. And when your face is a little rounder, and this is very common in my Hispanic and Middle Eastern patients, they have a more rounder face, but they want to have an angled look. All we need to do is just subtly define kind of the chin area and give a little definition in the cheek and balance out the lip, and now you have a more structured and kind of defined look, and it gives people a slimmer look and it's more attractive. So that's what we're going to do today. So go ahead and lay back and just relax as best you can. And we're going to start with just giving a little bit of definition in the chin. And we're going to use Restylane Define because this product actually does really well with projection in this area, and just really slow right on the bone. Not too much because she already has some anterior projection. I just want to get definition along the sides in the jowl area, because so many women hate when they see their mouth corners kind of going down. The one thing you want to be careful about with any of these fillers in this area is you don't want to overdo going laterally, because it can make them look like they have a chin strap. Okay, that's not what we're trying to do. We don't want to widen the jaw. You just want to subtly soften it so that the corners of the mouth are just are better. And what that means is you have to treat it in a three-dimensional approach. You actually have to do little bits all the way kind of around. Perfect. And then we're going to continue now on the opposite side. I'm doing a little shaking on here so it doesn't hurt as much. Turn towards me. Great. We'll do that same thing. Just very slow, small bits. And this is to give a little more definition and softening of the marionette line. Okay, let that sit for a second. Now see, that's already better, but again, you don't want to widen too far. So we're going to just kind of go a little bit along the actual jawline itself.
So how long does this stay before you have to do it?
This will stay about 9 to 12 months, and some people a little bit longer. With her, we're actually using needle because I really want to fine tune the positioning of her jawline and chin. And you see she's has a little more heaviness in the jaw area, so we're just blending it here so she gets a little more definition. And then what I'm going to do, perfect, doing great, to give her a little more enhancement, we're just going to go up into the cheek area, and laterally, when you do projection in the chin, we want to lift a little bit of the outer portion of the cheek area. Now this won't make her look bigger, it's just going to make her look a little defined. Makeup artists understand this because this is what they do with makeup to give people different looks. It's just subtle, nothing crazy, but that's going to balance what we just did. With her chin. Okay, because that just that little bit gives a sort of angled look. Yeah, like that's already better. See? So now we have a little lifting here and a little projection here, giving her more of a slimmer look. Wider up top, more narrow at the bottom. Now let's go to the lip. And she already has another thing, already has a nice lip shape. Let's just give her some more definition. So we'll start first using a cannula, and then we'll define after that. So what is a cannula, you guys? It's not sharp, so it shouldn't hurt nearly as much, and she definitely shouldn't get as much bruising or swelling. It's really good in areas like the lip, where, deep breath, where it bleeds very easily because there's a lot of blood vessels here. So we're right in the back of the lip here, and she has a beautiful filtral column. She has a really nice lip shape. You don't want to elongate her lip because her upper lip's longer than her bottom. So the majority of the product should be in the midline. I'm just doing a very small amount using Juvederm. Is it Ultra Plus or Ultra?
Ultra Plus.
Ultra Plus, which gives a nice kind of voluptuous look to the lip. It's going to look awesome. Okay. Hold here. I'm going to go to the other side. Switch me. Great. Anyone saying anything, guys? Tell me comments, okay?
Where are you located?
Well, you know the answer to that.
Okay, but
You
I'll
can
just.
answer those. We're West Hollywood, Los Angeles, California. I left that. You can answer those questions.
A lot of hi from Dubai.
We love our Middle Eastern patients. We love our patients. They were all just here. Our Dubai patients. It was great. I'm going to be coming there soon. I'll let you guys know when.
Ooh.
Dubai, Abu Dhabi, and Qatar. We're working on Moscow right now.
It's a tour.
Mm-hmm. Social media is going to be coming.
I've been there.
You'll be perfect
I've been through all three.
You'll fit in perfect.
I've been to all three.
It'll be great.
It's so humid.
You can survive it.
No,
You're made to survive it.
I
Your
thought
skin.
I was. The sun is fine. The humidity isn't.
I'm a Jew from the Midwest. I can't make it. Are you crazy? You barely make it here. Okay, so now we're gonna do the midline. Susie, how's the pain on that?
I don't feel it.
Love that. That's the point. I mean, the point is we want to try and limit as much downtime as possible. This feels a little weird on the bottom. You will feel this a little bit, but it shouldn't be so bad. So 1, 2, 3. Sorry. There you go. The lower lip has a little more fibrous connection, so 1, 2 there. Now once you're ready, you're fine. Good.
This feels weird.
Yeah. So we're going all the way across. I'm just first doing a little bit more posterior, a little deeper, to give her lower lip a little more plump, because the lower lip should always be about a third bigger than the top lip. On most people, certain ethnicities have it more even, like my Asian patients, and certain people it's way more, where the upper is a little bit bigger than African American patients. So we're going to switch to a needle. We're going to watch her lip. I need a, yeah. I'm going to switch to a needle now. And we're going to give her a little more definition. So let's start in the Cupid's bow and give her a little definition here. You see the definition here now versus there? So we're going to grab that column. Perfect. Go right in there. Let's give her a little more definition. Good. Now we'll give her a nice little lift. Just going to fine tune a little bit the base because she naturally had a little difference in size. Sorry. On both sides here. I want to give her a little bit more shaping to her Cupid's bow. She naturally has kind of what we call a W shape, where the lip comes out here but goes in there. You don't want to try and enhance that outer portion because then it looks worse. So you have to just try and lift a little bit the middle portion.
If
Good.
someone gets a cold sore easily around the lips, is this gonna trigger it?
It can sometimes, but actually very rarely does it do that. Oh, your lips look great. Show everybody show her her lips really quickly, if you guys don't mind, and then we'll go off and then we'll go into acne scars. But show her lips really quick because I want her to see her lip, her chin, and her cheek.
Oh yeah, that's good.
What do you think of this and this and this?
Oh yeah, that's good.
It's nice, right?
Yeah.
So you have more of this shaping,
Right.
and I think it's good. And you guys can see we define the column, define the filtral columns here. We give her a little lifting here. Now she's going to swell up. It will all go down, and then some balancing on the lower, projection in the chin and projection here. Now we're going to start acne scars in a second.